1201. So welcome everybody. My name is Michelle Lane. I am a leader here at North Kansas City Hospital, and I'm so excited to share this information with you today. We've got Brenda Swihart, who is probably one of the smartest people I know in regards to stroke and cardiac care. She is the program manager here at the hospital and is going to share some great information about how to know the facts to stop a stroke in its tracks. So take it away, Brenda, and thank you so much for coming today.
Thanks, Michelle. Thank you for that very nice introduction. So we're going to talk a little bit about strokes today. Whoa, I just went a little too fast there. So we're going to get some boring stuff out of the way first. We're going to talk a little bit about stroke statistics. Each year, approximately 795,000 people experience a new or recurrent stroke, with the majority of those, 610,000, being first-time strokes. That equals out to a stroke occurring every 40 seconds. Stroke is the #1 cause of serious long-term disability in the United States, and it ranks #5 among all causes of death, approximately 142,000 per year. I'm just a little click happy. Stroke also kills more women, twice as many women every year as breast cancer, and 1 in 5 women will have a stroke. Women are more affected from stroke. They die more from a stroke than men do. They suffer greater disability after a stroke than men. And we're seeing women ages 45 to 54 experiencing what we call a stroke surge. So that age group, we're getting younger and having strokes, mainly due to an increased risk factors and lack of prevention knowledge. And that's why women have greater disability and death from stroke, as they have different risk factors due to the hormones women have, pregnancy, and the use of birth control. And a little bit about race and ethnicity. American Indians, Alaska Natives, and African Americans are our highest risk group for stroke. The risk of a first-time stroke is double that for African Americans, and they are twice as likely to die from a stroke as Caucasians. They also suffer more extensive physical impairment. And then when we move to the Hispanic group, they're more likely to suffer a stroke at a younger age. The main reason for this increase in risks of stroke for this group is due to a high incidence of risk factors, especially hypertension or high blood pressure. Stroke has an estimated cost of $46 billion each year in the United States. And the great thing about this is that up to 80% of all strokes are preventable through risk factor management. In the US, there are about 6,400,000 stroke survivors, and that is a lot. This is a very old slide, but it shows you a little bit about the cause of death in each state and the death other than heart disease or cancer. And you can see Missouri right here has stroke as its major cause of death. And we have what's called the stroke belt right through here that has a higher incidence of stroke deaths than many other states. So there are two different types of strokes, and we're going to go over these just a little bit. There is what is called an ischemic stroke. That makes up for the majority of strokes, 85%. It is the most common. It is due to generally a clot that forms and blocks the blood flow to part of the brain. The other type of stroke is a hemorrhagic stroke, which makes up 15% of the strokes. That is where a weakened blood vessel ruptures and causes bleeding in or around the brain. And sometimes it's not actually a ruptured blood vessel, but a bleeding in the brain due to high blood pressure. So just a little bit more. This is a image. The very first image on the left is an image of an ischemic stroke that occurs when a clot or a mass, usually often from a fatty plaque deposit, clogs up a blood vessel and cuts off the blood flow to the brain, and brain cells die. And as we talked about, 87% of the cases are these. A hemorrhagic stroke, again, is a weakened blood vessel that ruptures. The blood accumulates and into the surrounding brain tissue, causes what we call a bruise within the brain tissue and compresses on those brain cells, which causes them also to die. The third thing is TIA, or transient ischemic attack. Often in layperson's terms, you will hear this referred to as a mini stroke. It is caused by a clot, but unlike a stroke, the blockage is temporary and doesn't usually cause any permanent damage to the brain. The symptoms are like a stroke, but they are very transient. That's why it's called transient ischemic attack, which meaning that they don't last very long. They go away rather quickly. However, that is still considered a medical emergency. Approximately 15% of all strokes occur after a TIA, so it does put you at increased risk. So we still want you to come into the hospital and get it checked out, even if the symptoms resolve. We do have a couple of types of treatment for those strokes that are caused by a clot in the brain, and it helps to reduce the damage being done. The first one being an IV medication called Alteplase or tenecteplase. This has to be administered within 4.5 hours of when the symptoms start. So it is very important to get to the hospital quickly. And by get to the hospital quickly, I mean call 911 at the first sign of a stroke. No family members who are there, make yourself aware of what the time is. So when they get to the hospital, they can tell you, you can tell them exactly when it started. The reason we want you to call 911 is that things can worsen, and we don't want you to drive and cause an accident. I've seen that happen. People have accidents, and it's because they're having a stroke. The second reason is that the EMS service can alert us before you get here, and we can be prepared and ready to go and assess the patient and be ready for you to go straight into our CT scan, which is the major upfront method of diagnosing if it is a bleed in the brain. It can't entirely rule out a stroke, but it tells us if you are eligible for this IV medication. The IV medication just busts up that clot and reduces your symptoms and your chance of being disabled from the stroke. In addition to that, with that medication, there's also something called a mechanical thrombectomy, and that's a surgical technique that physically the doctor goes in and removes the clot from the blocked artery. And this is a little bit kind of what it looks like. This is the doctor actually going in with the device and pushing it through the clot. And then they just pull that out and the clot comes out. And it's a great thing. We do not do those here, but we do transfer our patients to University of Kansas for this treatment. A hemorrhagic stroke is also called a brain bleed. You'll hear people talk about, say they had a brain bleed, and that's what they mean. These images here are from an aneurysm, which is many times what happens is the ruptured aneurysm causes the bleed. They can go in with what's called a coil. On the left, you'll see the coil, and they just pack that little aneurysm, and it's just a little outpouching. Let me get that word out. Little outpouching of the artery. And if it hasn't ruptured, they can coil it, and they just fill that up with a coil till the head of that aneurysm is completely blocked up and no blood is going to flow there. If it's ruptured, they'll use what's a surgical clip on the right hand side and just clip that aneurysm off. Now let's go into some recognition of stroke and risk factors. So half of Americans have at least 3 risk factors, and on the left are those that are modifiable, and on the right are those that are non-modifiable. So age, gender, your family history, your race, if you've had a prior TIA, stroke, or heart attack, and if you have migraines with auras. Those are not things you can modify. The ones you can modify and the ones that are highlighted in are the ones that are the major risk factors, hypertension being the #1 risk factor for stroke. But along with that is smoking, diabetes, high cholesterol, sleep apnea, obesity, and poor diet, inactivity, alcohol, drug abuse, carotid disease, a heart rhythm called atrial fibrillation. If you're at all familiar with cardiac risk factors, these are pretty much the same as they are stroke, and cardiac risk factors are very much the same. And I don't know why that slide looks blank. Does that? There we go. So more than 50% of Americans do not know they're at risk. They don't know they've got any risk factors. But as I said earlier, the good news is 80% of those strokes can be prevented. 77% of those first-time stroke patients do have hypertension, which is greater than 140/90. And 15%, as we talked about earlier, are preceded by a TIA. The risk of stroke increases 5 times if you have what's called atrial fibrillation, which is an irregular heart rhythm. It increases 2 to 4-fold if you are a smoker. If you have diabetes, it increases at least 1.5, and that's across all age groups. And if you have untreated moderate to severe obstructive sleep apnea, you have a 3 to 4 time risk increase. So talk about how to spot a stroke. This is a little warning signs that we use here in our facility and teach EMS to use, and we teach the public to use to be able to spot a stroke. The B fast, the B stands for balance. So if you have a sudden loss of balance, a headache, or dizziness, that could be a sign that you're having a stroke. E is for eyes. So if you have blurred vision, loss of a visual field, like you can't see peripherally, double vision, that can be a sign of a stroke. F is for face. So one side of your face is drooping, usually the lower face, the mouth is what droops. A is for arms. You have arm or leg weakness or both. It could be as simple as not being able to grasp something like your coffee mug, to grasp it well, or it can be very significant to where you can barely move that arm or can't move it at all. And it includes your legs as well. It's one-sided, not both sides of the body. Your S is for speech. You can have speech difficulty. That can also vary from not being able to say what you want, your speech being garbled, not being able to speak at all, or not properly identifying objects, calling something, calling your phone a pen, something like that. Things that just do not make sense or add up. And then T is for time, as I talked about earlier. Time is of the essence to be able to treat the strokes. So as soon as you recognize stroke symptoms, call for an ambulance immediately. Some additional signs of stroke that people have, they can have a sudden numbness on one side of the body, and it can be arm, leg, face, or all of the above. Someone who has sudden confusion, trouble speaking or understanding speech, but the sudden confusion that is an acute onset that is not usually present in someone who's usually alert, oriented, very quick with their thoughts, and they suddenly have confusion, you might want to consider that they could be having a stroke, especially if that is accompanied by falls, a fall, or more than one fall. When we see patients fall, and especially if they have more than one fall, we automatically, it's one of our things we look for and want to rule out that they're not having a stroke. We talked about the trouble seeing in the eyes, the dizziness, and this is all sudden. The thing to remember about stroke is these symptoms are sudden in onset. They come on quick and they will progress. So if you're dizzy off and on and you sit down and it goes away, probably not a stroke. I don't want to say dismiss it, but it's probably something that you could get checked out at your doctor's. But if it's very sudden, you get dizzy, you try to get up, you're leaning to one side, your balance is not there, that is something we definitely want you to come to the hospital and have checked out. Sudden, and the headaches, if you are having a headache that is stroke caused, they are sudden. They are the worst headache you've ever had in your life, and they are immediate pain. So call 911 again if you have any of those symptoms. Better safe than sorry. This is just something I'm going to let you kind of look at. And it is you can go to the American Heart Association has a wealth of knowledge out there, and it pairs up with the American Stroke Association. And you can download this for yourself. Just go to AHA.org and you can figure out if your risk is where your risk lies for having a stroke. Blood pressure, the atrial fibrillation, the irregular heart rhythm that I talked about, the diabetes and a high glucose, if you're overweight, if you have high cholesterol, if you're inactive, a family history of stroke, smoking. So this is a great tool to just baseline, know where you kind of are at risk for a stroke. Now let's talk a little bit about stroke prevention. So what is high blood pressure or hypertension? Well, a normal blood pressure is below 120/80. And then it goes to elevated, which is between 120 to 129 on the upper number, or what we call systolic, and less than 80 on the lower number, or what we call diastolic. Then it goes into hypertension stage 1, which is 130 to 190/80 to 89. Hypertension stage 2, which is 140 or higher over 90 or higher. At the stage 1, doctors are likely to prescribe lifestyle changes, and depending on your family history and the other risk factors that you might have, they may consider blood pressure medication at that stage. At stage 2, when you are consistently staying at 140/90 or higher, they're likely to go ahead and prescribe blood pressure medicines or a combination and recommend some lifestyle changes. At the next stage, which is the dark red, that's a hypertensive crisis, and that requires immediate medical attention. If your blood pressure suddenly exceeds 180/120, wait about 5 minutes, check it again. If it's still that high, contact your doctor immediately, especially if you're experiencing any symptoms such as chest pain, shortness of air, back pain, the numbness, the weakness, the visual changes, the difficulty speaking that we've talked about, that are related to stroke. If you're having any symptoms with the blood pressure being that high, just go ahead and call 911. So what does it mean to have hypertension? Well, as I said, nearly half of Americans do have high blood pressure, and many of them don't even know it. So to be diagnosed, you have to have your blood pressure measured, and generally your healthcare provider, which usually checks it when you're there, and if it's high, they may recommend that you get a cuff and check it at home, and they usually want more than one reading before they're going to say that you have high blood pressure. But what it means is that the top number is how much pressure your blood is exerting against that wall of the artery when your heart beats. And the bottom number is how much pressure the blood is exerting against that artery wall when your heart is at rest between heartbeats. So typically, our blood pressure does rise with age due to increased stiffness of our arteries, plaque buildup over time, which leads to an increased incidence of cardiac and vascular disease. And when your blood pressure is too high for too long, and your bad cholesterol or the LDL begins to accumulate along the artery walls, this increases your risk of developing a life-threatening condition. But having high blood pressure just hurts pretty much every system in your body, your brain, your kidneys, your heart, your eyes, and it can affect your sexual function. So if treated early and if you keep it under control, the effects can be prevented or reduced. So some of the things you can do to work on being healthy and prevent or control your blood pressure, and we'll discuss that a little bit here. Eating healthy, fruits, vegetables, fish, whole grains can lower your risk for stroke and heart disease, and avoiding salt will also help. Getting a good amount of quality sleep is essential to good health. Being physically active, and by that I mean doing something, just anything to get up and move throughout the day. Walking, if you enjoy outside activities when it's warm, not like this weather. Don't go out in this weather and start shoveling snow. But just any activity, any movement is better than nothing. If you need to lose weight, start on a healthy diet to lose some weight. If you smoke, it's a big risk factor for stroke. Just quit. I have no, I have no other anything else to say on that subject except you gotta quit. Controlling your blood sugar if you have diabetes, and again, managing your cholesterol. So know your blood pressure. Like I said, have it checked at least annually at your doctor's and work with your doctor to control that. Find out if you have atrial fibrillation. It's a type of irregular heartbeat. If you have that, work with your doctor to manage it. And again, if you smoke, just stop. I know this slide is a little blurry, but it talks about high blood pressure not usually having any symptoms, so you may not know about it, and it's often treatable. The best way of learning if you have it is to get tested. And during the month of May, just making a little plug for stroke, May is stroke month, and during the month of May, the American Heart Association does a lot of screenings during that month. This is just an example of a little log that you can keep, and this is downloadable also from the American Heart Association. If you have a home blood pressure kit, the monitoring your blood pressure at home will help determine if you're on treatment, if it's working, if you're not, if you just want to monitor your blood pressure and make sure that you're doing well. Also, just making a plug for our screenings that we have through outreach. Those are excellent ways to get your blood pressure monitored. So I just want to talk a little bit about what's important to do prior to taking your blood pressure to get an accurate measurement. So don't smoke, don't drink any caffeine or alcohol, or exercise within 30 minutes. Usually the first thing in the morning and in the evening are the best times to check your blood pressure. So sit in a very comfortable chair, resting with your arm resting comfortably. This says left arm, doesn't really matter which arm you use. If you're right-handed or left arm. Take 2 readings, excuse me, at least 1 minute apart. Do it before you take your medication in the morning, and also in the evening if you take medication in the evening. Make sure you use a cuff that is the proper size that fits you well. And the bottom of the cuff needs to be just above the bend of your elbow. So here's some good things that can come by reducing your blood pressure. So just a 10 millimeter reduction in your top number, your systolic blood pressure, can reduce your risk of coronary heart disease by 17%, your risk of stroke by 27%, and your risk of heart failure by 28%. What things that can raise your blood pressure are alcohol, as we talked about. So if you drink alcohol, just limit your intake daily or less, depending on how much you drink. But if no more than 2 small glasses per day. Drugs such as antidepressants and amphetamines, we have been seeing many more strokes attributed to drug use in recent years. And it's very unfortunate, but it is a fact that we have to deal with. And caffeine. So again, more guidelines. If you drink alcohol, do so in moderation. Know your cholesterol numbers. And again, as Michelle said at some of our outreach events, they do test your lab work. So know when we have our events, and make sure you get signed up for them, because they're a great way to understand where you are health-wise. If you're diabetic, follow your doctor's recommendations. Include exercise in your daily routine. Like I said, just anything, any small thing is good. I have to force myself. I will admit that. I'm not a great one, but I do exercise. But even during the day, I have to force myself to take a break and just take a quick lap around the hospital, just to get a little bit of blood flowing again. Enjoy a low-fat, low-salt diet, lots of fruits and vegetables. And if you have circulation problems, some people have circulation problems, and you can work with your doctor to improve that. Walking does help circulation, but it can only do so much. So sometimes there's other measures that have to be taken. And then lastly, I can't emphasize this enough, is to call 911 if you're experiencing any stroke symptoms, because every second matters. Discussing blood pressure with your physician. If you're struggling with any of the guidelines of trying to maintain a good blood pressure, like a low salt diet and medications, exercise, or if you're having a lot of stress, discuss that with your physician. Always bring a complete list of your medications with you to your appointment, including any over-the-counter medications, vitamins, any herbal supplements that you take. Bring something to take notes on, because we often listen to the doctor, and then when we leave the office, I know I'm guilty of this. I'm like, what was it he said about this? And if you don't have someone else there with you to be a listening ear, you can take notes. Bring your blood pressure log with you. The one that I showed you that is downloadable, or any log. I know through the outreach events, they give you a blood pressure log. Bring that to your physician visit with you so that he can see how your blood pressure's been doing over time. Just a little word about medications. They only work when you take them regularly. So your medication should be taken at the same time every day. The next one's key. Don't stop taking your medications without consulting your doctor first. That's an absolute, don't do it. And then the last one that can help keep your medications sorted, especially if you have to take many, is to use a calendar or a pill box. As a reminder, there are lots of pill boxes out there, morning, evening, days of the week, whatever works for you. And lastly, just to sum it all up, like I said, small changes can make a big difference. You can manage your blood pressure and keep it in check. You can stop smoking. I didn't mention vaping, but if you vape, that's very bad for your system as well. So cut that out. Eating a heart healthy diet, reaching and maintaining a healthy weight, getting regular physical activity, limiting your salt intake and your alcohol intake, and taking your medications as prescribed. All these small steps can lead to big changes. That's all I have. Are there any questions, Michelle?
I am looking. I don't see any questions. I don't see any questions. That was wonderful, Brenda. That was so helpful. I was hoping that you were going to talk about the value of doing your blood pressure correctly. When we're out in the community and we're screening people, they come hustling in and they got their legs crossed and they sit down in the chair and, teaching people you need to sit for 5 minutes and just relax a second to get a really accurate reading is so important. And just looking to see the difference in those two readings. Like I'll check somebody, okay, I'll check you. And then I make them sit for 5 minutes and then I show them, the impact that can make.
Right.
One of the other things that I think is interesting, I was reading a research article the other day, is, if you are going to do a log, to check your left arm and your right arm occasionally just to make sure that they're pretty close in numbers. There was a good study about carotid artery stenosis, and that, one change in the arm can show that maybe there is some potential blockage in those carotid arteries. So that's something you want to check every now and again.
Yes, that's a great idea. Yes.
Mhm. Well, thank you so much, everybody, for joining us today. Please go to www.nkc.org and check out all of our screenings. I'm there with Bree and Jacqueline, and we've got nurses out there that are happy to sit down and go through your numbers with you, set goals for you, have you come back in another 30 days, and really make an impact on your health. Everybody have a great day and stay warm.
Thank you.